Hi everyone, Dr. Sarah here. Before we begin, please share this video with every woman in your life. Today we're talking about breast cancer signs that most people miss or ignore, signs that could literally save your life if caught early. As a healthcare professional and someone who's worked with breast cancer patients, I'm sharing critical information that everyone needs to know. Breast cancer awareness is essential because early detection can significantly improve survival rates. Many women assume that only a noticeable lump is a cause for concern, but there are numerous other subtle symptoms that are often overlooked. This video is designed to educate and empower you with knowledge that could help save a life. Our goal is to ensure that every woman has access to the right tools and understands the importance of regular screenings. So whether you're watching this for yourself, a loved one, or to spread awareness, let's take this journey together and prioritize women's health. The power of awareness. Did you know that 1 in 8 women will develop breast cancer in their lifetime? But here's the good news. When caught early, the survival rate is over 90%. Stay until the end for a free downloadable self-examination guide. The key to survival is awareness and action. Many women delay screenings due to fear or misinformation, but knowledge is power. Understanding the early signs, risk factors, and preventive measures can make all the difference. Throughout this video, we'll break down everything you need to know in simple, actionable steps. Breast cancer does not discriminate. It affects women of all ages, ethnicities, and backgrounds. By staying informed and proactive, you can take charge of your health. And remember, you are not alone. Millions of women are standing with you in the fight against breast cancer. So, take a moment, share this video, and let's work together to spread awareness and promote early detection. Often missed early signs. Let's start with the subtle signs many people dismiss. Often we associate breast cancer with a noticeable lump, but symptoms can be much more varied and sometimes hard to recognize. Paying attention to small, seemingly insignificant changes in your body can make all the difference in early detection. These symptoms may not always be painful or obvious, which is why so many women overlook them. If something feels off, don't dismiss it. Early intervention is key. Now, let's take a closer look at some often missed warning signs. Beyond the lump. Slight skin texture changes, like orange peel texture. This change occurs when lymphatic drainage is blocked, causing the skin to appear dimpled or pitted. While it might look like a minor irritation, it can be an early indicator of inflammatory breast cancer, an aggressive but treatable form of the disease if caught early. Barely noticeable nipple changes, such as inversion, scaling, or discharge. Many women assume that slight changes in their nipples are normal, especially with aging or hormonal shifts. However, new changes that persist should always be checked by a doctor. Mild discomfort that comes and goes, unexplained tenderness or pain not linked to your menstrual cycle. Breast pain is not typically associated with cancer, but when it's persistent and occurs in a specific area, it's worth investigating. The new normal, that isn't. Changes in breast size that happen gradually. Even subtle differences may indicate underlying issues. While fluctuations in breast size can be due to hormonal changes, sudden or gradual enlargement of one breast without a clear reason should be checked. Subtle differences in breast symmetry, a shift in shape that doesn't seem to revert. Minor asymmetry is normal, but noticeable or sudden changes in one breast shape or fullness should be examined further. Mild but persistent itching, especially if accompanied by redness or flaking. Chronic itching, particularly around the nipple area, could indicate Paget's disease of the breast, a rare but serious condition linked to breast cancer. Silent signs. Changes in breast temperature, warmer or cooler than usual. Inflammatory breast cancer can cause one breast to feel warmer due to increased blood flow in response to abnormal cell growth. Subtle skin color variations, redness, darkening, or slight bruising. Changes in skin tone, particularly if they don't fade, could signal underlying issues and warrant medical attention. Vein patterns that become more visible, especially if new or pronounced. New, prominent veins on the breast surface could indicate increased blood flow due to tumor growth and should be evaluated. Daily prevention tips. Prevention is powerful. Here's what you can do every day to lower your risk. While no single factor can completely eliminate the possibility of developing breast cancer, small, consistent lifestyle choices can significantly reduce your risk. Maintaining overall health through diet, exercise, and awareness is crucial. Let's explore some everyday habits that can help keep your breasts healthy. The 20-minute daily activity that reduces risk by 30%, brisk walking, yoga, or strength training. Exercise helps regulate hormones and reduce inflammation, both of which are linked to cancer prevention. 3 foods to include in your daily diet: leafy greens, berries, omega-3 rich fish. These foods contain antioxidants and healthy fats that support cellular health and reduce cancer risk. Simple habits that make a big difference: limiting alcohol, reducing processed food intake, and staying hydrated. Excessive alcohol consumption and a poor diet have been linked to increased breast cancer risk. Self-examination guide. The best time of month to check: a few days after your period, when breasts are least tender. Regular self-exams help you become familiar with what's normal for your body. The 3-finger technique, using different levels of pressure to feel for changes. This method helps detect abnormalities that may not be visible to the eye. What normal actually feels like: soft, uniform tissue with no hard lumps or thickening. Understanding your baseline breast texture makes it easier to notice changes. Risk reduction. Understanding your family history, talking to relatives about their health histories. Knowing your genetic risk can help guide screening and prevention strategies. Environmental factors you can control: limiting exposure to toxins, using BPA-free products, and avoiding tobacco use. Everyday products contain chemicals that may contribute to cancer risk. Lifestyle changes with biggest impact: maintaining a healthy weight, balanced diet, and stress management. Chronic stress and poor health habits can contribute to hormone imbalances, increasing cancer susceptibility. These signs need immediate attention. Some breast cancer symptoms are more urgent than others, and recognizing them quickly could save your life. If you experience any of the following red flags, don't wait. Schedule an appointment with your doctor as soon as possible. Ignoring persistent symptoms or hoping they will resolve on their own can lead to delayed diagnosis, which reduces treatment options and survival rates. Early intervention is key, and being proactive about your health is one of the best steps you can take to protect yourself. Red flags. Sudden changes in any breast tissue: swelling, puckering, or dimpling. These changes indicate abnormal tissue growth and may be linked to cancerous developments. Any noticeable shift in breast appearance, even if painless, should be examined by a healthcare professional. Unexplained pain patterns: sharp, persistent pain unrelated to menstruation. While some women may dismiss occasional breast pain as hormonal fluctuations, ongoing discomfort or pain in a specific area could indicate an underlying issue. Skin changes that persist: rash, flaking, or ulceration around the nipple. Skin abnormalities, particularly those that do not heal or worsen over time, may be a sign of Paget's disease or an underlying cancerous condition. Common misconceptions. Why waiting it out can be dangerous. Early detection saves lives. Many women hesitate to seek medical attention for minor symptoms, assuming they will resolve on their own. However, breast cancer progresses over time, and early intervention is crucial to successful treatment. Age myths that put you at risk. Breast cancer isn't just for older women. Younger women can be affected too. While age is a risk factor, young women can and do develop breast cancer. Any unusual symptoms should be taken seriously regardless of age. Why it runs in the family isn't the whole story. Most cases occur without a family history, so screening is essential. Only about 5 to 10% of breast cancers are hereditary. This means that even if you have no known family history, you should still follow recommended screening guidelines and monitor changes in your body. Let's turn awareness into action. Knowing the signs and risks of breast cancer is only the first step. Taking action is what truly makes a difference. Here's what you can do right now to protect yourself and others. Download our free self-examination guide. This guide walks you through the steps of a proper self-exam, helping you recognize what's normal for your body and what changes to watch for. Schedule your next screening. Whether it's a mammogram or a clinical breast exam, regular screenings increase the chances of catching breast cancer early, when treatment is most effective. Share this information with 3 women you care about. Awareness spreads through conversation. By sharing this knowledge, you might help someone catch breast cancer at an early stage. Remember, early detection saves lives. Don't become part of the 97% who ignore these signs. Check the description for our free resources, and leave a red heart if this video helped you learn something new. Next week, we'll discuss another crucial women's health topic: Until then, take care of yourself.